Welcome to my next video about autoimmune diseases. Similarly to the previous episode, one will talk about the causes of autoimmune diseases. It is known that there is no single cause. Rather, it is a number of interrelated factors that have not yet been fully discovered and researched. However, the role of hormones is not controversial among scientists and doctors. In the previous episode, we analyzed, in a very simplified way, the impact of estrogen, the female sex hormone, on the immune system and the increase in the risk of women developing these diseases. In today's video, I will focus on the functions and impact of another hormone on the body, the so-called stress hormone, i.e. cortisol. I will tell you how it affects the immune system, what are the causes and symptoms of disorders in the work of this hormone, and how you can monitor its level and how to keep it in balance. This hormone occurs in both men and women. The name stress hormone may be misleading for many. This suggests that increased cortisol levels cause stress, which weakens the immune system and causes inflammation. Meanwhile, the opposite is true. The factor causing inflammation is stress, and cortisol, through its inhibitory effect on the immune system, is an anti-inflammatory factor. People suffering from autoimmune diseases know that corticosteroids, i.e. synthetic cortisol drugs, are on the front line of the fight against the recurrence of autoimmune disease and inflammation. This may seem incomprehensible. How can a hormone whose levels in the body rise dramatically as a result of a stressful situation also effectively treat the inflammation resulting from this stress? The relationship between stress and the immune system and stress hormones is not as simple and easy to explain as it seems. So what is the role of cortisol in the body? It is quite complicated and, as you will see, at some stage of the process its role is reversed. This hormone is responsible for providing the body with the energy needed to respond appropriately to stress in a situation, such as a threat. For this reason, it is sometimes called the survival hormone. For this purpose, this hormone produced by the adrenal cortex activates the metabolism by raising sugar levels. There is a sudden release of cortisol from the adrenal glands. By raising blood sugar levels, it supplies the body with the energy it needs to respond properly. Since every reaction of the body is related to the expenditure of energy, the reaction of the immune system is also related to the expenditure of energy. In times of danger, i.e. severe stress, such energy consumption is unfavorable and the principle of economic profitability comes into play. This reduces the activity of the immune system, i.e. the so-called suppression, which may be complete or only weaken the immune system's response to some extent. This is the most correct and beneficial mechanism in situations of short-term stress. Here we can talk about cortisol as a friend and ally. However, in a situation of chronic stress, there is a problem of imbalance between the production and use of cortisol by the body. Normally, cortisol levels decrease after stress ends. The body can relax and the immune system returns to a state of balance. However, long-term stress, the accumulation of smaller stressful situations, such as lack of sleep, irregular meals, pressure at work, family life, or the so-called high-speed life, all this leads to dysregulation of the mechanism of mutual connections between the immune system and cortisol. A constantly slightly elevated cortisol level in a situation of chronic stress turns from an anti-inflammatory factor, suppression of the immune system's response, into a pro-inflammatory factor. The balance and the ability to harmoniously exchange signals between the adrenal cortex and the immune system are disturbed. The immune system becomes deaf to weak signals from cortisol and simultaneously loses control. It becomes dysregulated. Cortisol turns from an ally into an enemy. A sufficiently large dose of corticosteroids is able to restore the lost balance. We said that chronic stress results in complete dysregulation of the adrenal glands, leading to the so-called adrenal fatigue. This condition may also occur in healthy people who do not suffer from autoimmune diseases. This makes life difficult for both sick and healthy people. There are a number of symptoms. They may include sleep problems, fatigue, hair loss, depression, panic attacks and others. Does this mean that you are only doomed to synthetic corticosteroids? Sometimes yes. There is no other, better and more effective solution. However, You can often help yourself by supplementing the treatment with natural plant substances with adaptogenic properties. Such a plant is, for example, ashwagandha or rhodiola rosea. During periods of remission, it is worth checking the cortisol level. The best way to do this is to test it in your saliva. Low levels of cortisol in the blood are often ignored by doctors. Since the production of cortisol is very individual, different situations may be stressor for each person, and it is difficult to clearly assess whether a given situation causes stress or not. The most important thing is to know at least approximately what is happening in the body and how to react. Sensors for measuring electrodermal activity already exist on the market. They capture and transmit signals indicating impending emotional stress. Thanks to the warning, you can consciously use a relaxation technique, reducing to some extent the negative effects of stress. I do not provide the brand of this device because it is not a commercial film. I encourage you to watch the next episode, where I give you more proven natural ways to modulate the immune system.